Okay. Just for Zoom folks, my name is Molly Overkamp, and I'm here with my colleague Amanda Melton presenting on how to use REDCap as an electronic data capture tool as a regulatory binder. So our goals with this presentation are to talk a little bit about how REDCap can be utilized for more than just data collection or tracking subject interaction, and how existing REDCap tools can be customized to increase your regulatory compliance and just generally make your study run more efficiently. This is especially true when we think about single IRB, multi-site studies, but all of this can be used in single site studies as well. We'll also talk a little bit about when REDCap is an appropriate tool for your eReg binder based on the details of your study. And then we'll also talk a little bit about a study that we both work on as an example as to how REDCap surveys can be used as a tool to capture protocol deviations and adverse events, as well as some other tools in REDCap that can be used to track other essential documents. What we do want you to keep in mind is that this may not be perfectly applicable to your study. Really, what we're trying to do is talk about how REDCap can be used beyond its typical uses. So we invite you to consider the details of your study while we're presenting today. All right. And the study that we're going to talk about today and the build that we're talking about today is based on the ICH GCP defined essential documents and the IU HRPP record retention requirements. All right, so you may be asking, why would I use an electronic reg binder? Big thing is coordinator time, right? With paper, we as coordinators are needing to keep track of note to files, delegation of authority logs, and pass those from person to person to get those necessary signatures. But with REDCap, we can easily obtain those signatures digitally, we can set up automated reminders, and we can get notifications when those documents have been returned to us. And when we're thinking about multi-site studies, that becomes even more helpful. Another good reason is accessibility, right? With paper, your reg binder is living in a specific location that may not be accessible to everyone on your team, especially if people are working off-site or at different institutions. But with REDCap, everything is accessible from one place, and everyone on your team can log in and make those updates in real time. Plus, when we think about other institutions, those institutions use REDCap, they're not going to need training. Another good reason is compliance. With that automated audit trail, your compliance is really strengthened. And we'll also talk about how you can use the e-consent feature with version tracking to have a more robust audit trail. And all these features that I've been touching on make starting and closing a study much quicker because you can duplicate your REDCap project and you don't need to start from scratch every time. All right. So as for when REDCap would be appropriate, our study team determined REDCap was going to be a good fit for the study that we started for a few reasons. The study we'll be talking about today is single IRB. IU is the lead site of 5. And our study was not federally funded. It's not NIH funded or FDA regulated. So we were not required to comply with 21 CFR Part 11. And importantly, we started our study in 2023, so before the features that Dr. Harris was talking about this morning were implemented. This study is observational and under expedited review, so no biospecimen collection or equipment logs, and there are also no renewal logs, as IRB renewals were not required for our study.
So I'm going to walk us through the basic REDCap build, including some of the arms and events. Then we'll review the surveys we created for tracking adverse events and protocol deviations across sites, since it's a multi-site study. The surveys are based on the available IU HRPP templates that you can find on the HRPP website. And then finally, we'll review some of the instruments we created for regulatory document tracking, such as version tracking logs, delegation logs, and protocol training logs. So the first arm that we have here, we decided to do 3 arms, and we determined the arms based on what we would need to use as the record ID and the ease of generating reports. So The first arm we have is for compliance and safety. We created an instrument for tracking protocol deviations and adverse events. And so you can see that each record ID would then be a different adverse event and a different protocol deviation. And we created reports separately to be able to track those separately, adverse events versus protocol deviations. Our second arm we did for study staff information. So we have contact information for study staff. We have delegation of authority logs. We have protocol training logs. And then each record ID would be a different staff member. And finally, we have arm 3 is for tracking. So this is for all of our regulatory document tracking. So any amendments that go in, any IRB correspondence, it's just one record ID for tracking logs, and then we go in individually to each instrument to update the information that we need. So we created an instrument to capture study adverse events and decided to enable this as a survey because the REDCap e-consent and version tracking features. So if at some point we decided to update the survey, we would still have copies of the original that the site coordinators had filled out. So we would always have something in the file repository for the original. Additionally, by having a survey, it allows users to enter the information and then use the save and return later features so that data is saved, it's tracked in the REDCap survey. We can go back and see the history, so leading to that audit trail ease. And then because it's a multi-site study, we created a public survey link or a survey link that we sent to all site coordinators. So staff at those sites don't need to have IU REDCap access. They just complete the survey link as needed whenever there's a situation at their site. So then the actual content of the survey is based on the IU HRPP template, and it includes IU definitions throughout. It includes links to the IU HRPP website to give other sites the definitions that we use here at IU and make sure that we're all following the same information. So we incorporated those definitions and links. And then we carefully considered when we were creating the survey, when we wanted to use field validations, for example, for a subject ID, we decided not to make that a specific number or anything like that so that it could be multiple numbers. And for the date, we decided that we wanted to use field validation on that. We also chose to use branching logic to only collect the needed information depending on how serious the adverse event was. And then we considered which fields we really wanted to make required versus which fields we were okay if they completed the survey and we had to follow up with them later and fill that out. So with that branching logic, you can see this was a minimal risk study. So it was a low chance of adverse events. We had in the protocol that we weren't collecting all adverse events that could be happening because it's really just a one-time survey. And so we incorporated stop logic so that we were preventing staff from erroneously reporting unrelated adverse events. So it triggered the survey end. If we didn't need to be collecting an adverse event, we have it set up so that we're not collecting information we don't need. This is just another example showing that we included the definitions throughout to really help walk staff through the process and ensure consistency across all sites, across the entire study. And this is, again, all based on the IU HRPP template and definitions. So then we implemented the save and return later feature so that staff could complete the form. They could come back and edit it if they weren't ready to necessarily submit it, if they didn't have all the information that they needed. And we could still see that saved history in REDCap, all the saved data. Every time they save and return later, we can go back, we can see anything that's changed towards that audit trail of REDCap. And then because it's just a survey, we were able to generate a report where we can track all the different adverse events. It mimics the adverse event tracking log that's found on the IU HRPP website. And then we can easily edit and filter it if you want to filter by site, if you want to filter by date, however you want to generate the report so that you can see all the adverse events going on. Any questions so far?
I do have a question. So on the form, it said the requirement for like the PI to initial it. You can save, like return it later, but most likely the study coordinator is the one who's filling out the survey. So how do you make sure that like in your audit trail, actually have it on the PI's REDCap now, or do you like?
Yeah, so that's something that we were really challenged by, and because it was a PI, well, an investigator-initiated study, we don't have to require like any NIH FDA. What we have, it is the coordinator that's completing the survey. They're saving and returning later, and then sending the link and the access information to the PI to go back, review, and electronically sign and date and everything. So unfortunately, it does just show the survey respondent, but we're hoping to capture in the survey, I don't have the entire survey on here, but we have like who is completing the actual survey. So the study coordinator is putting in their contact information, separate page than the site PI signature and information. Any other questions so far? Go back in on our side when we log in as an IU REDCap user, we can go in and show that we've reviewed the adverse event, or reviewed the protocol deviation, we've done and taken whatever actions that we need to use. And we did that at that in the PDF as well, because I
You need to turn the audio
Yes.
off.
so this.
Yeah.
Really sorry. So that sites could download and so we
time.